Lifetime Family and Urgent Care, your doctor for a lifetime.
Hi everyone, my name is Alyssa Ruane and I'm a physician assistant student at Gannon University. Today I'm going to be taking a few minutes to discuss heart disease and the way that it affects women differently from men. So whether you're a woman watching this yourself, or if you just have women in your life that you know and love, it's really important that we stay updated and educated when it comes to risk factors, signs and symptoms, and prevention of heart disease in women and the ways that it's different from men. So specifically today, I'm going to be talking about something called acute coronary syndrome in women. So before we begin, I'll just briefly define acute coronary syndrome, or ACS, which is basically this umbrella term that describes a bunch of different diseases that decrease oxygen or blood flow to the heart suddenly. So when we think about ACS, the big thing everyone thinks about would be a myocardial infarction or a heart attack. The reason I decided to do my presentation about ACS in women specifically is that over the past several decades, we've seen a dramatic decrease in mortality rates of men who experience ACS, which is great. However, we're not seeing that same decrease when it comes to women. Specifically, young women are actually experiencing an increase in the mortality rate associated with ACS. I believe a lot of this has to do with a lack of education, some biases, and some misinformation when it comes to women and heart disease. So today I'm going to be talking about 5 different myths and the ways that we can debunk these in our personal lives related to our personal health or just the health and safety of our family and friends. So myth number 1 that we're going over today is that heart disease only affects men. A lot of people know that heart disease is the leading cause of death in America. In 2019 and 2020, even at the height of the COVID-19 pandemic, heart disease still killed twice as many people as COVID-19. However, when we think about people who experience heart disease, a lot of times we think about middle-aged or older men, typically overweight, people who drink and smoke and don't exercise enough. And so it's really important that we reframe our brains to think about heart disease to include women, specifically young women, older women, and women of all shapes and sizes. So when a study was conducted by the Cleveland Clinic and Americans were asked, 68% of Americans did not know that heart disease is also the leading cause of death of women in America. And even more concerning, 80% of millennials didn't know this. So we think about breast cancer and motor vehicle accidents, and there's a lot of public education about these things. However, we can't overlook how important it is to discuss heart disease and to include it when we think about potential diseases and risk factors for women. We know that 1 in 5 women in America die of heart disease every year, and so it's really important that we place a lot of emphasis on this and that you continue to educate yourselves and your family members about the risks and prevalence of heart disease. So myth number 2 that we talk about is, I am not at risk. So when we talk about risk factors for heart disease, a lot of people think about having high cholesterol or not exercising enough or being overweight. However, the risk factors for women are actually different when we consider risk factors for men. Even more importantly, female patients are much less likely to have their cardiac risk factors addressed by their medical providers. And so it's really important that we stay educated and up to date about our own risk factors and the ways that we can mitigate these in order to keep ourselves heart healthy. So when we talk about risk factors that affect females, some big important risk factors are diabetes, depression, smoking, and rheumatoid disease, which have all been shown to increase risk of cardiac events in females more than males. So in one study, it was found that diabetic females have a 57% increased risk for heart disease when compared to their male counterparts. Also, things like depression and smoking and rheumatoid disease prove that it's possible that you yourself could have some risk factors for heart disease and not even know about it. So again, it's really important to ask your doctor, ask your medical provider, what are my risk factors and how can I mitigate these in order to prevent heart disease for myself or my family members. Myth number 3 that we talk about is, if I was having a heart attack, I would know. So it is true that most patients, male and female, who present to the emergency room with a heart attack typically complain of chest pain. And so obviously, if you or a family member is having chest pain and you're concerned about a heart attack, it is extremely important that you go and get yourself checked out. However, females, much more commonly than males, also present or can present alternatively with what we call atypical symptoms. And so these symptoms can either occur at the same time with chest pain or can occur by themselves. So some common atypical symptoms we see with female patients include things like shortness of breath, sweating or shakiness, chills, back pain, jaw pain, and even sometimes just a general sense of fatigue. A lot of times female patients are reassured that they're not having a heart attack because they have something like chills or shakiness or sweating. I read one study where a large number of females who present with a heart attack actually thought that they had the flu because they had these chills and shakiness. So it's really important that if you are experiencing chest pain of any kind, but also just new symptoms that don't feel right for you, that you contact a medical provider in order to screen yourself for cardiac disease and specifically ACS. Myth number 4 is I should wait to see if things get better first. This was extremely disappointing for me to hear, and it is a big problem, especially when we consider women who have chest pain or heart disease. So it was found in one study that women are much more likely to delay their treatment when compared to men. It was found that women feel embarrassed, they don't want to be dramatic, and that they felt like they were nervous to waste their medical provider's time. In one study, it was found that women over 65 years delay their treatment by 266 minutes longer compared to men. And less than 65 years, females were delaying their treatment up to 148 minutes longer. In medicine, we have a saying that time is tissue. And when it comes to our heart, we say time is muscle. And for every 15 minutes after the first hour experiencing chest pain, it was found that female patients increase their rate of mortality by 1.6 times. This is extremely significant. It was also found that female patients die in the hospital twice as often as male counterpart patients. So 12% for female patients and only 6% for males. A lot of this has to do with the fact that female patients delay their treatment and that they don't seek care immediately. And a lot of times this can have really devastating outcomes. So it's really important, whether you're experiencing symptoms or if a family member or someone you know is experiencing symptoms, to really advocate to make people feel comfortable to go and get checked out. You're better safe than sorry. The last myth that I'll talk about today is that there's not much I can do. And I've heard this from patients who believe, I just don't have a good heart, or I just have a really bad family history, or I lost a parent to heart disease when they were very young, and there's not really much I can do about it. So we know that that's not the case. And education and being an advocate for yourself and your family members is really critical when it comes to cardiac care. In one study, it was found that up to 80% of Americans don't know that you're supposed to get your cholesterol levels checked starting in your 20s. It was also found that 1 in 5 people did not know that vaping and electronic cigarette use is actually bad for your heart. In one other study, only 1 in 5 Americans knew that the Mediterranean diet is the best diet to use when it comes to protecting your heart and cardiac health. So these things, and just in general, seeking medical care, making an appointment with your primary care provider, understanding your risk factors, eating healthy, exercising, these are all huge when it comes to preventing heart disease in your family and friends. And last but not least, like I said earlier, education and making sure that you educate not only yourself, but also your family members and people close to you in order to decrease our chances of getting this heart disease and in order to better detect and treat heart disease in our loved ones. Thank you so much for listening to my presentation. I have a short survey if anyone's interested in giving me some feedback. And aside from that, stay healthy, stay safe, make an appointment with your primary care provider. If you're in the Wesley Chapel or Zephyr Hills area, make an appointment to see Dr. Yusuf and his staff at Lifetime Family and Urgent Care. And if not, then make an appointment with your providers elsewhere and make sure that you're keeping up to date with your heart health and the heart health of your loved ones. Thank you so much and have a good day.
Lifetime Family and Urgent Care, your doctor for a lifetime.